Good morning, good morning. This is Dr. Mejia. Today we're going to be talking about combining swab tests and antibody tests for COVID-19 for a better diagnosis. I would like to dedicate this video to the frontliner, to the rapid responders, to the health providers, and also to the housekeepers who's making our place clean and sanitized. Today is April 9, 2020. It's the birthday actually of my eldest brother. Happy birthday to General Mariano Mejia. So on my last video, we talked about the difference between COVID-19 swab test versus antibody tests. So let's just review a little bit about it. The swab test looks for the presence of the virus per se, the viral RNA and the viral protein. It does not look for the antibodies. Now, positive swab test means you have the virus and you have the active infection. It does not rule out virus infection. Why is that? Because it's only 70% accurate, at least the swab test that we were doing a month ago. Nowadays, it's rapid now. Actually, just last week, the FDA had cleared Abbott to distribute their 5-minute testing. And I believe it should be available now nationwide. So what are the limitations of the COVID-19 swab test? False negative can happen if the collection is inadequate. So make sure that the ones collecting your specimen has a lot of experience doing it. It can happen if it's collected very early in the disease process. For example, you were exposed 5 hours ago, don't have the test right away because it could still be negative. Now, on the other hand, false positive can happen. It's rare, but it could happen during cross-contamination if there's a specimen mix-up. Now, let's review the COVID-19 rapid antibody test. It looks for signs of immune response to the virus, but it should not be used as the sole basis for the diagnosis of COVID-19. Now, what does a positive antibody test means? It means that you have current exposure or past exposure to the virus, not current infection. It also identifies if you have recovered from the disease or if you have some immunity from the infection. The limitation of COVID-19 antibody tests. It could cause false negative if it's done very early. Again, as a rule of thumb, you use the antibody test after the first week. You could do a serial testing of this. And a false negative can also happen if you don't have a lot of antibodies to be detected by the kit. A false negative test can also happen if the kit is damaged. Now, false positive can happen if you have a past or present infection from other viruses that's kind of related to the COVID-19. So swab test would give you positive or negative, but it would not inform you about your immune status. The antibody test would show you negative and several positive in here. Now, I don't recommend the one that's at home testing because honestly, a lot of health providers cannot interpret this one accurately. You need to combine it with the swab test. You need to combine it with clinical findings to have an accurate diagnosis. Because for example, negative does not mean you don't have the virus. And having the IgG, which means that you have long immunity does not mean it's from the COVID-19. It could be a false positive. It could be from your previous infection from other viruses. So it's a little bit complicated, but I'll try to make it simple in this video. So hang in there, because at the end of this video, you would know exactly where you are. So as I said, it has to be combined with the history and the clinical presentation. So let's review the clinical history of COVID-19. Once you're exposed, the first few days, you don't have any symptoms. And as the virus multiply in your body, then you start having the symptoms of fever, colds, loss of um, taste, cough. But if your immune system is intact, you'll start having an immune response, and the first antibody that appear is the IgM. They're short-lived though, but our immune system is robust that will start having the IgG production. And this is the one that have the long-term immunity. Got it? So now that you know about the swab test, you know about the antibody test, you know about the natural history of the virus, let's dissect it, shall we? So let's talk about this one, the first one. You have a swab positive and your antibodies are still negative. What are the clinical scenarios? Well, it's probably because you were just exposed and you're on the incubation or asymptomatic stage. You are here. So you're swab positive, which means you already have the virus, you're infectious, but you don't have any symptoms. Now, it could also be because you're in the very early stage in which the antibodies are not detected yet. You're having signs and symptoms, but you don't have any antibodies yet. Or for patients that are immunosuppressed, they're positive for the swab or the virus, but because they're immunosuppressed for some reason, they don't have any antibodies. These are the ones that become really, really so sick. So for somebody that's really immunosuppressed, I really suggest that you stay home, okay? Now, what about if you have a swab positive and an IgM that's positive? Then you are probably on the early stage of infection. And what about if you have positive for the swab test and both of the antibody test? Then most probably you are on the active phase of infection. But the good thing is that, you know, your immune system is responding. Now, what about if you have a swab test, IgM positive, but the IgG is negative? Most probably you are on the early stage of infection, except that the swab test is false positive. Again, you have to correlate this with the patient. Now, what about if the swab test is negative, but both of the antibodies are positive? That's actually a good sign that you are on the recovery stage of the infection. You're feeling better. But on the other hand, if you're not feeling better, you're still very, very sick, it's probably because the swab test was false negative. Now, what about if the swab test was negative, the IgM was negative, and the IgG is positive? Then this is a sign that you have cleared the virus, you have passed infection, and has recovered from it. This is the test that we want to say that our kids can go back to school. Yoo-hoo! This is also the test to say that we could go back to work. And that's what I want for me. I don't know other people though. These are also the tests that we want for the stress eater to stop. Hey, you can start eating healthy again. Now, what about if you have a swab test that's positive, IgM was negative and IgG was positive? Well, there are two scenarios in here. It could either be a relapse or a false positive IgG. So, on this scenario, you had the disease, you were positive for the swab test, then it becomes negative, you get better, okay, but you start having symptoms again, you become sick again, and the repeat swab test was positive. Well, it's probably because you did not develop enough immune system or immune antibodies. IgG is supposed to be for long-term antibody, but the testing that we're doing is just a qualitative test. It doesn't really tell whether you have a very high antibodies or a very low antibodies. So if you have a very low antibodies, then you are prone to have reinfection or relapse. Now, what about the other scenario, false positive IgG? Well, suddenly you become so sick, you went to the hospital, to the laboratory, and they did the swab test, it was positive. But on the other hand, they did the IgG antibody test and you're positive for the IgG. Well, it means that the IgG is positive. It means that you probably have a past infection from other viruses that's kind of related to COVID-19. That's the only explanation for that. Lastly, I would like to talk about the carriers. By definition, there are three kinds of carrier. The carrier during the incubation period, those are the asymptomatic, the convalescent carrier, and the healthy carrier. The healthy carrier is kind of a misnomer because all of them are positive for the swab test, which means they have the virus, they're infected. So healthy is, to me, is not really healthy. Now, during the incubation period, because it's too early, you don't have the signs and symptoms yet, and you're not responding to the antibodies yet, so that's the incubatory carrier. Convalescent carrier is when you're positive to everyone. It's a good sign that you are already responding to, your immune system is responding, but on the other hand, you are still infectious, so you're not ready to work. And as far as the healthy carrier, they have the virus, but they don't have any symptom. Why is that? Well, I believe they still have the antibodies, except that it's not enough to clear the virus, and it might not be enough to be detected on the antibody test. Okay, so they said that this is about 25% of the population. I'm not really sure, because to do that, you have to test almost everyone in America. There's like 325 million. So I'm not sure, although we're doing all the rapid testing now. The thing is that I don't recommend the at-home rapid testing, primarily because, again, this is not a simple positive negative testing, and also we need to collect the data, and if you're doing at-home testing and you're not reporting it, then we can't have an accurate data. So this is just a summary of what I'm talking. So you could take a picture of this, and to have an accurate diagnosis, you really have to combine the clinical presentation of the patient, that is the history and the physical findings. You have to combine it with the swab test, and you have to combine it with the antibody test. I hope you learned something today. Thank you for watching. Thumbs up if you like it. You could comment on it and please share it. Thank you.